My name is Babide Damal, the team leader, Cheerful Arms Foundation, and I'm the head organizer of this medical camp that is taking place in Namutumba district, on Nawandio village, and it is Chibale Town Council. We are privileged to be hosted in this village by the leadership of this community, and we are happy that we've come back to serve our people in this community. The reason why I brought this camp closer to the people is to serve the people that are underserved. Those underserved communities normally don't get these laboratory services or treatment services on time, meaning diagnosis and treatment is done always at a later time, which affects their health and their lifestyle. So the reason why we are here is the background was after the degree, now what happens? What is the reason? So I looked upon it after graduating from Makerere on the 25th of Feb from Makerere University, that no, does the degree really benefit me? What has it added on me? So I went ahead to sit together with the team and the board members of Cheerful Arms Foundation to decide how best do we give back to the people that educated us, that supported our education, that made sure that we go to school up to that level. And that's where this idea came from, to actually to give back to the community or to the people that really supported you during your education. Now give them your skills, give them the services that actually they sent you for. And that's how this medical camp came to be into service. This community lacks a health center. In the community there is a burden of malaria, which has always been high in this community, and diabetes, it is always high in this community. And now we looked at the sickle cell, and here we are. We extended the service to this community to see that they get this service also. Surprisingly, we've gotten a high level volume of people who are positive with this disease, and those who are positive with malaria disease, it is also high. Still, that is still a demanding and a very huge burden. We've gotten high levels of diabetes according to the data that is already with the lab team, meaning this community really deserves or requires to be accorded a health center that is nearby that can serve them better. It will be a good initiative for this community that we shall reduce, for example, on the crisis of sickle cell that they've been experiencing, but they didn't know that actually they have this burden. They thought that this is witchcraft because they've never tested. But those who have tested and they were told still have that myth that this is not right. Now here on the ground, they've confirmed that actually it is true, we have the sickle cell, and it is the threatening disease that is really growing up. So I go through the Ministry of Health, through the government, and I'm requesting that if it's possible and the government finds this suit to accord us that health center, through the President Yoweri Kaguta Museveni and through our permanent secretary, Dr. Diana Twini, please, we request that this community can get a health center to enable them have that access to the health treatment, to the health services that are closer to them. I want to thank the partners that have worked with us in this medical camp, and that is NHLDS, National Health Laboratory Diagnostic Services, that is headed by Dr. Susan Nabada, the Commissioner and Executive Director of the laboratory services. We want to thank Mestos Family Clinic, we want to thank Purity Family Clinic and Lila Institute of Health and Management Sciences. It's found in Lila City, which is headed by Mr. Alfredo Luke. And we want to thank the local government of Namutumba district through the DHO. We did counseling and we did health education. We talked about the value of the education. We tested for sickle cell, we tested for diabetes, we did the analysis, we tested for malaria, we tested for syphilis and all other kinds of diseases we really tested. We've given treatment to those that were sick, and we referred those who needed a referral to the nearest health centers. If we get the opportunity to have a medical center on this community, it is even easier because one of the community members got the burden and donated the land to this community. That land is located just still nearby where we're hosting this medical camp, and we've witnessed its presence. It is already having a title. We just request the government to just come up with starting with a construction process, because the land is already there, donated by the community member.